Welcome back to Therapy Thursday. Today we're going to address a specific question that came in regards to our prior 3 Therapy Thursdays that looked at a phase 1, phase 2, and phase 3 approach that we take in treating Achilles tendon pain. Before that, I want to address 2 things that you're probably wondering. Yes, that is a children's tattoo and it is Lightning McQueen. It's what happens when you have a 3-year-old son. The question this time was specific to one of our YouTube videos, and it was from a woman that was dealing with a very reactive or swollen Achilles tendon. She was asking specifically, by using the 3-phase approach that we presented, how long it was going to take for her Achilles pain to either get better or her tendon to heal. And like most things in the therapy world, the answer is not straightforward. And there's a few reasons for that. The primary reason, like we mentioned in the first blog, is the lack of clinical correlation, or how somebody feels with their imaging findings, specifically on ultrasound or MRI. So we're going to put up 2 images here. The ultrasound on the left is of what we call a normal patellar tendon, or the tendon that's responsible for jumper's knee, and on the right is a dysfunctional or problematic tendon. That's great. However, from just those ultrasounds, we would not be able to predict A, who's in pain to begin with, or B, how long it's going to take for somebody to recover. So because of this, the way that we approach Achilles tendon pain, or tendon pain just generically, is by looking at a person's clinical signs and symptoms, trying to fit them on a model whereby we can incorporate the 3 phases that we just chatted about and give them realistic expectations. The newer research in regards to tendinopathies or tendon pain say that the #1 hindrance to people getting better are unrealistic expectations. And when you start to delve more deeply into that, the expectations are not inappropriate from the patient side, it's typically from the therapist side. You might go in with a very reactive tendon that's all swollen, you can barely walk because it hurts. Walk into one therapist's office and they might say, this is only going to take 2 weeks to get better and you'll be running. Or you could go and visit a second therapist and they'll say, I'm not 100% sure, could take 4 weeks, it could take 8 weeks. In truth, the second therapist is probably being more realistic, but the patient is going to go with the first therapist because they think that the person's going to get them better much quicker. Take that aside, specifically with tendon problems, if we're looking at a runner, if you say you've got a stress fracture, there is no problem whatsoever with the person sitting for 6 weeks, even casting it. It's the mindset that changes. For whatever reason, therapists have created these unrealistic expectations in regards to tendon problems, and it might take a little bit longer to get better. That's why it's important to follow a structured approach like what we presented over the last 3 weeks, and specifically having criteria about when to progress from phase 1, phase 2, and phase 3 to ensure that your tendon is sound from a clinical standpoint before you return to play and get better. Thanks for watching Therapy Thursday, and we'll see you next time.